why did you even want to become a rheumatologist? What was it about rheumatologists that even made you, do it once, not once, but twice? You ended up doing it all over again. What was it?
And I definitely did it twice. I love it. There is a combination of different things. I think the number one is that it's chronic in the sense of you create a relationship with a patient, and it's not like the emergency room or the intensive care unit where you see the patient one time or twice and then that's it. Like I could not become an ICU doc. I could not become an internist just because you don't get to see your patients afterwards. And I really love my patients and they become part of my family. I want to know what's going on in their life. And I have no problem sharing my own life with them. It's really this trusted relationship. So that was like the number one. The number two is that it is a fascinating topic, right? Like we are talking autoimmune. Everything is rheumatologic now. We're talking autoimmune. We're talking like, why is it that the immune system decides to overreact and cause all of this inflammation in our body? So I'm fascinated by that. I think it's so interesting and really like the art of finding the right treatment that's like the least amount of immunosuppression for our patient. I think is a really interesting thing. So when I was doing research, and I'm still doing research, but a bit less, I love doing research in rheumatology because I felt that it was really touching upon some fascinating topics of immunology and inflammation. So that's like number two. Number three is that I like being a doctor that gets my patients better. And there is no other specialty that does that. I mean, it's incredible. I started rheumatology when the TNF inhibitor started, and I started seeing patients that were crippled suddenly becoming fully functional. And it's only been getting better and better every year. And I love seeing my patients doing better. And I always tell them we're aiming for remission with treatment, maybe, but still remission. And so that is my goal for my patient, is to get to remission so that they can live the lives that they were meant to live. That's like the third one. But there's so many reasons, but like I am never bored in rheumatology. It's just like such a cool specialty. Yeah. All of the reasons.
I think you're going to get total agreement on this end. And I think that's something that's common probably to our generation of rheumatologists, and probably why a lot of us went into rheumatology, is that is when the biologics came out. And that is when we saw that dramatic change where people who previously were just, it was a lot of hand holding is what I called it. And you have to talk about everything but the pain you're experiencing with your doctor. And when these medications came along, they were just revolutionary. So I totally resonate, I think, with a lot of rheumatologists as kind of just that like light switch that, oh my God, this is where we can make an impact in people's lives. So, but you mentioned something about research, and I do know that you've had some experience, a lot of experience with research in rheumatoid arthritis.
Yeah, I love it.
Do you have a case of kind of, I think, maybe just an interesting case of a patient that you've seen that you'd want to share, and maybe somebody with rheumatoid arthritis, maybe, so that we can.
Oh no, I have many cases, but I'm gonna. Well, actually, do you want a case first, or do you want to tell me about research first?
I will take whichever. I will take research first, and then we'll do a case.
Okay, let's talk about research. I'm going to share one of my favorite studies that I was the first author on, so I was really involved. So we looked, it was at Columbia University, and we looked at the heart of patients with rheumatoid arthritis. So patients with rheumatoid arthritis have more chance of having heart failure, heart dysfunction, and so on, and cardiovascular disease. And so the thought was, why is it that patients with rheumatoid arthritis have more risk of heart issues? And very brilliantly, my mentor, Dr. Baton, was like, well, maybe it's because there is inflammation also in the heart. How do you look for inflammation in the heart? Well, it turns out you can do MRI that lets you to look at the inflammation. You can also do PET scan. I love PET scan. I think that are such a cool way to look at the system. And just for background for patients, it's actually very easy. You basically take glucose, and glucose is literally like anything that you're eating is going to go to glucose, because glucose is what you use as an energy. So imagine like fuel, like, you know, when you put gas into your car, that's glucose, right? Like imagine that you're putting glucose, and you mark the glucose, and then you take a picture of the body, and in this case the heart, but you can do it for the whole body. And what you're going to pick up is the inflammation, because inflammation is basically what's happening when you have inflammation is that the organs pick up more, like they act more, they are working more. And so you're basically looking at this glucose that has been marked, and then you can do pictures. And so you can use a PET scan for cancer, infection, inflammation. And in rheumatoid or in rheumatology, we love it for vasculitis, which is inflammation of the vessel. We love it for inflammation of the heart. And so that's what we did. We looked at the heart of patients with rheumatoid arthritis. But mind you, that none of those patients had cardiovascular disease. So we were looking at the heart saying, okay, we want to look at the heart of our patients with rheumatoid arthritis, knowing that they don't have any cardiovascular disease. Well, a lot of them had inflammation of the heart. And it doesn't stop here. With treatment, we did a very small study looking at before and after treatment, so TNF inhibitor in this case. So with treatment and triple therapy, we saw that they were decreasing their inflammation of the heart. And so then it comes down to, when you're treating your rheumatoid arthritis, you're not just treating your joint, you're treating every single inflamed organ in your body, including the heart and including the vessels. And so that is my favorite study, because I think there is it's like very often in research, you don't really see right away the endpoint. Like you're not seeing like, oh, is it actually going to make a difference in my patient's life? And in this case, I'm like, holy cow, this is really making a difference, because we have not just a proof of concept, we have the proof that what we've been thinking this whole time is true. There is inflammation and not just the joint. So make sure that you go into full remission with treatment.
And
so that's the research.
That's perfect.